All righty. Okay. Record. Okay, you guys, we are officially recording. I am Professor Jennifer Harrison-Hauer, and this is Exam 1 review. It's a beautiful 6 p.m. here in Tucson, Arizona, 9 p.m. in other parts of the world and other time zones. If you guys can if you're not able to, because we share all of this information with your professors. Yeah, there you go. You type your name in so that it shows up and it just looks really good when you attend one of these. Um, so let's go ahead and get started. I will share my screen. I have a PowerPoint to share with you guys. This, by all means, is not all inclusive, but I think it's a pretty good review. All righty, you guys. Exam 1 will take place, as most of you already know, during whenever your scheduled classes next week. Your professors will be in touch. You have the entire class period. That is your class, is the exam. Whether you finish in 35 minutes or take the entire class. I've known people to get A's both sides. Don't rush through it, but that is your class. And the last class, we usually have grades posted by Sunday. I teach a Friday class as well. And so, after everybody's taking their class, and so I'll have students email me, what's my grade? I'm like, we're still working on it. All right, so let's get started. It is interactive, you guys. I know it's late on your end, but stay with me. Okay, so before you even go out to, let's say you're working with a group of a homeless shelter, or let's say a homeless camp at a certain part of town. You define this is your community, this is your population that you're going to work with. Leslie, what is one thing you're going to do before you even go out there and start anything? What are you going to do beforehand?
I want to make sure, I guess, analyze where I'm going. Am I going to be safe? What am I going to bring? Tell
Right,
everyone where I'm going. Keep my phone charged.
right. And then what type of research are you going to do beforehand, Sophia? What are you wanting to know?
I guess I would say the demographic that you're gonna be working with,
Mm-hmm. Mm-hmm.
um, the type of probably health problems that do they have.
Yes, yes. Before you guys, just like when you go to clinicals and you're going to be working with Miss Smith in room 110, you're going to review her chart, you're going to review this, review that, looking do as much research as possible on what's ailing her. Look at her med list, look at contra. You're going to do all of that. You guys already know that. So population health is the health status of a defined population. So I'm going to use the example of a homeless camp on 1st and 10th. I don't know. So you have your defined, that's your population that you're going to be working with, including the distribution of health. So you want to, before you even go out there, you want to know as much about the folks that you're going to work with as possible. And safety first, safety first. But you also want to look at too, like as much as you can. Part of that is like, okay, their status, what's their knowledge? Are they aware of, um, that there's been, COVID outbreaks? Looking at prevention, looking at playgrounds if it's applicable. You want to just do your assessment on your community first before you even go out the door. And so, talking about patients' rights, patients, unless they're declared incompetent, the patient should be able to. They have self-determination. They can. We may think we know what's best for them. We have all of this healthcare knowledge and all of this or what have you. But at the end of the day, it's their decision and their choice in their life. I've known folks that were on dialysis for years and like, you know what, I'm done. I'm just like done with this. And so we have to be respectful. We want to be their advocates all the way with this, because at the end of the day, it's their choice. So keep that in mind. The primary focus of community-based nursing is care of ill patients and families, but also we're managing chronic diseases. We're focusing on primary, secondary, tertiary prevention that we'll get into a little bit further. And then the whole point is that when you have your defined population and you're going out there, however you find them, you want to leave them whenever it's said and done, however long you spend their weeks, months, years, leave them better than how you found them. And that honestly should be your like focus when you're in clinic or what have you. If somebody comes in a 10, by the end of your shift, if they're not any better, we need to figure out why. And so we work with individuals, families, communities. Okay. So if you have your community, yes, you're working with individuals in that community, and your focus is on the greater good. So if you have a homeless camp and you're working with, that's your population. Yeah, you may work with individual folks in that, but you're let's say you're giving flu shots out to everybody out there so that that influenza doesn't spread through the camps and what have you, teaching about hygiene and the like. One of my favorite slides, and I like to talk to, when I talk to my class and lecture, when you go through your weeks, if you earlier on get a solid understanding of primary, secondary, tertiary, I can almost guarantee you, because I don't like to do guarantees, you'll do very well in this class, because I was a public health nurse. I still work on a reservation. I've been out there 15 years. I started out as a public health nurse, and I was assigned to districts. Just think of like Mockingjay and what have you. And inside those districts were villages, remote villages. And so that was my focus, was, okay, how can I make sure, because we've had Rocky Mountain spotted fever, we've had dengue, we've had syphilis outbreaks, we've had pertussis, whooping cough, we've had some things. And so we want to, in a perfect world, have no one with any chronic diseases, anything afflicting them. And so you want to live in the land of primary as much as possible. They're all important, and we're going to go through the slide, but that's where you want to stay at the bottom of the pyramid. Because if you notice, the colors are green, like the stop sign, green and yellow and red. That's what it's trying to tell you there. So let's get into primary. And again, when you think of primary, I like to memorize, or just little simple things. Primary prevent. So Badala, you were in my class earlier. I cannot see your beautiful face, but I see your name. Okay. Would you like to share an example of a primary prevention effort that we talked about, or that you want to share with everyone?
Yes, we talked about immunization.
Yes. That's a very good, if you think primary prevent immunizations, you'll be good there. So again, prevention, primary. There is not a disease that exists anywhere, and we want to keep it that way. That's primary. And so also think of, when you think of primary prevention, it includes a big piece is health education, health promotion, education. And so I've had students that say, well, Professor Harrison-Hauer, you know, there was something about diabetes and, there was education, and why wasn't that correct? Because a disease exists. As nurses, you should never stop educating your patients. Like I mentioned earlier in my class, if you're a chemo nurse and that's that's your world, and you don't educate that patient, that they may lose their hair and they're going to may wake up one day with a big old bald spot and you didn't educate them. Education never stops, but a disease exists. So you don't want to get tripped up on that. Primary, nothing exists. I mean, think about it. Have you ever thought, why are they giving me a flu shot? I don't have a flu. So that's what they're trying to do. So then remember that no disease exists. You're trying to prevent, primary prevent. All right, I beat that horse up. Secondary, think of screenings. Think of your mammograms, think of your colorectal cancer screenings, think of screenings you're looking, you're detecting. Also think of surveillance too. When you're doing, like, that CDC is wonderful at doing that. And any of your health departments, when they notice cases are going up, so they're monitoring health status. But screening, secondary screening is good to keep in mind. But again, no disease exists when you begin your screening. If you're looking, a mammogram, I'll just use that example. If they find a lump, or if a woman palpates a lump, it doesn't mean she has cancer. She could have a cyst. I mean, she could have cancer. I hope not. But they won't know until they actually do biopsies and get a piece of that tissue, which is not what we're here to talk about today. But again, you want to keep it extremely simple and realize that secondary is screening. The only prevention that has to deal with any type of disease that you need to know is tertiary, which is that red square at the top. And so someone has diabetes, someone has asthma, someone has hypertension, etc. Okay. And so if you get to tertiary treat, they're trying to give you guys little clues here, then a disease exists. But you're always going to educate someone. You're going to educate someone about insulin, when to take their carbs, and, well, all of that stuff. So if a disease exists, that's tertiary. And so when I think of, everybody likes to use the example, diabetes, you have new diagnosis, it's a whole thing. They got to get feet checked, all the kind of stuff. But the point is, you're trying to, everything is prevention. You don't want them to lose kidneys and toes and amputees and what have you. But you're never going to come back down to primary, because they always have that disease. I have patients that manage their diabetes quite nicely. They've lost a few pounds. They don't need insulin no more. They don't need metformin anymore, but they're diet controlled diabetes. What breaks my heart when I hear, I got a little bit of sugar. No, you got diabetes. You got it. I'm glad you're controlling it, but you still have it. So yeah, so keep that in mind, you guys. All right. My screen wants to be stuck. All right, here we go. All right, so Medicaid versus Medicare. So when I think of Medicaid, for me personally, I think of Band-Aid. And when I think of Medicare, I think of caring for elderly people. You don't have to remember it that way. But Medicare is care for individuals 65 or older. And it's these lovely baby boomers that were born in like 60s and what have you, like after Vietnam. I'm gonna get into all of that. They're getting older. And so they're using Medicare and using a lot of it. The impact on the federal government's insurance program for people 65 or older is increasing. Medicare is expected to be enormous. The spending for that is projected to be growing faster and faster because of the baby boomers. They can't help it. I'm happy that they're getting older, but it's tapping out the Medicare funds. And I personally would like for it to be there when I get older. But anyway, And Medicaid helps those with low income and classified as unable to work or disabled. So in the United States, we have two systems for healthcare systems. You have your private, think of Blue Cross Blue Shield, that sort of thing. And then you think of public, what we just talked about, which is the Medicare and the Medicaid. Issues with the healthcare system that we're all aware of, and should be aware of, is access to healthcare, those that have and the have-nots. And then private and public people with insurance, or those who can personally pay, are often viewed as receiving superior care. That's how it's viewed. That's how many times have we called the doctor's office, and this is nothing against insurance, I'm just being real, where they're like, what kind of insurance you got? What's your number? So that's that. In a country that we have the highest number of billionaires, it's just, I promise you, I'm not going to get on that soapbox. All right, the working poor, those who do not qualify for public funds, either because they make too much money to qualify. Those folks that are in the middle are especially vulnerable. Hence, we have the Affordable Care Act. When the Affordable Care Act passed, more folks were able to have health care. And that's just a wonderful thing, because that's how the system functions, is some form, because I can't write a check for all of my health care needs. And certainly probably not the person at the homeless camp. So healthcare and all of its issues is a huge, huge public health, again, public health concern that you should be aware of. And so it passed to help more Americans have access, increase Americans who can afford it, and then increase quality and lower costs. So keep in mind that one change with the Affordable Care Act is that more folks were able to purchase it, and so it became more affordable, hence the name. Affordable care is access, has lower costs, so that's something to keep in mind. There's lower costs, lower costs associated, too many A's, with the Affordable Care Act, which is great. If anyone has been overseas or lived in other countries, in comparison to, again, we have the largest number of billionaires. It's just our mortality rates, infant mortality rates for a country as rich as we are is just not, and this is not a personal thing, it's part of the slide, just unacceptable. Okay, so Family Medical Leave Act started in 1993. I actually remember when this act came about. I really do, because it gave everyone, employees flexibility with taking off leave for family issues, being a caregiver, without having to worry about losing your job, because the federal government with this particular act said, nope, we're going to allow them to take off if they want 12 weeks after they have a baby, or if they adopt a kid, and that sort of thing. So it's wonderful. It's a wonderful act that came about. And a lot of my patients, like I said, in clinics, if they have chronic issues, if they have, they get a lot of migraines. I'll give that as a good example. And they have to call out a lot, and they bring in the FMLA paperwork. And if it's signed by a healthcare provider, a doctor, NP, and they invoke their FMLA, they cannot lose their job. So, and then American Disability Act, you guys just be aware of that. It's pretty self-explanatory. It was passed in 1990. The quality and safety education for nurses is not federally mandated. I guess what that means is it's a private entity. But what I like about QSIN, to keep in mind, it's actually a pretty awesome place to find information. It helps nurses improve what we do. And there's a lot of different organizations and companies out there, but they want you to know about this particular one. So QSIN, Quality and Safety Education for Nurses, just like it says, making sure our quality is on point, making sure that we're safe. We talked about evidence-based practice in my class. It's a great place to find information, hint, hint, patient-centered care, safety. This is a lovely organization, just another of the many organizations that are out there to help us do the best we can with our patients, providing evidence. So, all righty. Speaking of evidence-based practice, another lovely one of my pyramids. Where to start? Anything that you do provide in nursing should be backed by evidence. When you're doing reviews, if you're looking up information on a medication, there are reputable sites to go to find information on medication that's evidence-based. We used to carry a book with us. I think everything is online or what have you. But you want to have reputable sites that have been researched and scientific and proven, and they're not difficult to find. So you want to use best practices in making decisions because you're taking care of somebody's mom, somebody's auntie, that sort of thing. So keep that in mind. And when you're looking at evidence, this slide here has it ranked. And when you're doing your research, you want to pull from the top of the pyramid opposed to the bottom. So when you're looking at systematic reviews, that is just like, if you can get a hold of a good systematic review where somebody has basically done all the work for you, that's just like golden. So systematic reviews are like when people, researchers, they summarize research, several research articles about a given topic. So let's just say somewhere down the line, they start putting out systematic reviews about COVID. So let's say they come from researchers have done stuff at CDC and World Health Organization and all these articles. Well, someone or groups analyzes these articles and put them together in a review process. So you have all of this summary nicely put together so that you don't have to go around like they've done the work for you. So it's evidence-based, it's peer review, it's all of that stuff. The research has already been done. The results are already out. And so when you're doing your research on a given topic, let's just say systemic lupus, and you're looking at all of these different, you can find folks that have already done systematic reviews on that topic. So that's why it's a small part of the pyramid, because it's a lot of work, but somebody has to go back and review that. So that's your gold standard. Your randomized control studies is just that, when you have people are assigned randomly, not even the researcher knows. They got letter X, Y, and Z, double blinded and all that stuff. And it goes on to there when you have cohort studies, case control studies. Your gold standards are the top. You don't want anecdotal. It's like, it's almost like a verbal report almost. It's not research. If you're saying it's not evidence-based, and you're probably like, well, why is it on there? Because it does exist. It's an option. I don't think I've ever even used an anecdotal expert opinion. These are like personal stories, and there's nothing wrong with, let me see if I can give you an example. Like somebody, I don't know, giving a personal story about their time in concentration camp or something, their experiences. There's nothing wrong with their experience, but you have to keep it like scientific. So as far as scientific evidence base is far down there. And so when people are looking at your research and they're seeing what you're using, just like when you guys did your healthy people and all of that, first I'm like, where are they getting their information from? And you know, that because you're telling me that I should believe what you write down based on wiki. I'm just saying you wouldn't, but you know, but if you got CDC, I'm like, okay, all right, okay, good, all right. So I already trust CDC, even though I may not know you, but I know CDC and I know World Health Organization. So you want your stuff to be reputable. So make sure you know that, and then health disparities and vulnerable populations. This slide looks busy, but it is so very important. Oh, and let me digress. If I did not mention, because folks will always ask me, I cannot personally share my slides with you. You can feel free to review this over and over till the cows come home. So please don't ask me. You can ask, but I can't. All right, so health disparities. The largest impact is economic. So that means it's related to finances, access to healthcare, paying for different things. They usually have folks with health disparities, higher chronic disease is often seen in groups, less follow-up. Again, the typical picture for me is the person that's nothing against folks in the homeless camps, but they're exposed to the elements, they're out there, they probably have different conditions that's affecting them. And so the 7 food factors are listed here for you as far as what impacts health disparities: income and social status, education, low education is linked, safe water, clean water, do they have a place to shower? Are they employed? How are the roads, physically, the community? Social support, do you have friends, family, community, someone, belief systems, genetics, health services, gender. All of these 7 topics are good to know factors that can impact or negatively impact someone's and place them at being at risk for different ailments. And so where do I want to go with this? So as a public health nurse, these are different targets, some things that you can change in the system with as well. So for example, the physical environment, getting them access to clean water and that sort of thing. Another word that you may hear interchangeably with health disparity and vulnerable populations, social determinants of health. And I just have some information here. So social determinants of health are the conditions in which people are born, grow, live, work, and age that shape their health. So let me give you an example. Let's just say somebody was born in war-torn area of some part of the world. So they were born and their environment, there was a war going on. That's where they was born, that's where they grew up, that's where they live, that's where they work. And let's just say that somehow they get out of it and they come over to the United States at 70 something with probably 1 or 2 several issues, not including like, I'm not saying mental health concerns, but all of the negative impacts of not being able to have clean water, access to care, medications, and that sort of thing. So your nursing interventions, you know, there's always interventions, which means something you can do, are designed to help vulnerable populations gain access to what they need. Okay. Again, you can think of the person in the homeless camp. You can think of a child that's homeless. You can think of a pregnant teen, somebody with asthma. I can keep going. And so this picture alone should should speak volumes to what we're going to talk about. So then, vulnerable populations, know your definition of vulnerable population. If you should see this again anywhere, you should be able to pick out what makes this person vulnerable. So it's a group. Vulnerable population is a subgroup. So then you have a group, and then you have your subgroups. So let's just say southwest part of town is this group, and then they have a huge tenement camp or homeless camp. That's the subgroup of this population in this part of town. It's more likely to develop health problems as a result of exposure to risk. What are those risks? Glad you asked. A, B, C, and D. All right. There's environmental, and they give examples of lead paint, but environmental could be the fact that, you know, they are in an area that's next to a landmine. I don't know. Social hazards, there's a typo there. Crime, violence, personal behavior, diet, lack of adequate diet, nutrition, especially for children, you know, as they're growing. Exercise, you know, that's all important for your body. Biological and genetic makeup, are there any compromised conditions and what have you? And this, it may seem like a lot, like, I can't do this all by myself, but as a public health nurse of many years on an indigenous Indian reservation, you're never alone. You're not doing all of this by yourself. It's a team approach, and I'll just say that. So then let me move this image out of the way. By now, this is a busy slide, but by now we should have an idea of, okay, so that's wonderful. What is it that we do? And we mentioned this throughout the entire presentation, but you want to know the primary goal is completely different than your bedside nursing, because prevention, 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 prevention. It's different things in different levels, but that's your ultimate goal, period. That's why you go out and you use mass vaccination drives, because you're trying to prevent something that has never even occurred. And so these are the things that are listed here. You want to, again, focus on the prevention of disease and disability. So when they say prevention of disease, think of giving the flu shot, and then think of prevention of disability. Go to that tertiary and think of somebody has diabetes that's uncontrolled, and you're trying to prevent them from getting foot ulcers and all that kind of stuff, and all of that, and not lose their leg. We're population focused. So then again, if you're the school nurse, that is your population. And then there's always policies that are in place, but you want to be familiar with policies for the department where you work, and so that you work within those set guidelines. But just getting a little bit about policies, anything to try to help, again, reduce mortality, death related to communicable diseases. So people will write policies based on that, like, okay, so this is what we're going to do. We're going to write a policy for school health that children, blah, 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 and get this done, what have you. All right, but the policies are focused on public health so that we can decrease illness and complications. So the leading cause of mortality has shifted to chronic disease. I mentioned it in my class earlier that, you know, back in the 1900s or whatever, folks didn't make it to 50. 50 was probably an elder. They died of just Spanish flu and yellow fever and malaria and all this stuff. I can't remember the last time I heard somebody that died of malaria. I'm sure it has happened in other places in the world, but you don't hear about that anymore. But anyway, so now it's chronic. So you're looking at chronic conditions, asthma, hypertension. I had a young patient of mine died a couple of weeks ago of of asthma-related exacerbation, young girl. So, heart disease and cancer. Anyway, so the increase in the number of older adults, an increase in population, you're going to see more of those baby boomers, and I hope not, but chronic conditions because age and things may occur. The population of the world is increasing due to increased fertility rates and then decrease in mortality rates. There's going to be a lot of people on this globe. And so as far as health disparities is concerned, you want to be aware of what the health disparities are for your population. You want to be aware of a lot of things so you can help reduce those.
Can I ask a question about the last slide?
Oh yeah, you guys can ask any questions you want because I will just keep going. Talk to me.
Can you explain the first sub bullet?
Who? Go back.
The one about independence and autonomy?
Oh, I think that was like way back there, but hold
Right
on
there.
to that.
The second bullet.
The second slide. We could ask hold your questions at the end because unless I can, is it one of these?
No, the one we were just on.
This one?
Yeah, one more. Yeah, that one.
Oh,
It's
okay.
promotes independence with a nurse and autonomy.
Okay, so the primary goal of public health, the prevention and disease and disability, okay, achieved by ensuring that conditions, okay. Promotes independence with the nurse and promotes independence. Okay, so as promoting independence, I can do your stuff for you, but I want you to take care of yourself because I'm not going to be around forever. I mean, I'm only assigned to take care of you for 6 weeks. And then I need you to learn how to take care of yourself. This is how I learn how to explain stuff. I don't need you to be dependent on me. I need you to be able to take care of your own chronic conditions. That's why you don't want to get there. Because if you do a health promotion and a vaccine and all of that fun stuff, and it's perfect utopia, I don't have to worry about managing your diabetes because I'm making sure you get your healthy weight and what have you. But I need, faith without works. I need you to do something yourself. I need you to be independent. I need you to care about your health enough to put that donut down. And I can't be around Leslie forever to help you put that donut down. And your sugars were already high. And I need to talk to your granddaughter about telling her not to get you Krispy Kreme. I really do. So, yeah, get some wheat toast and put some jelly on it. Does that help? I don't know. All righty. Healthy People 2030. So if they specifically have information about Healthy People 2030 on your study guide, especially if they talk about school health, I would think that's important. But this particular slide, so Healthy People, all that is a whole bunch of information. I know this, but you only need to worry about it if it relates to whatever you're talking about and is covered. Does that make sense? This Healthy People goes, it's for everything. It's this public health priority for the United States that started way back when that I'm going to help focus on individuals, there's school stuff, there's community stuff, there's environmental health stuff, there's stuff for stuff. One of my students like, there's so much. I'm like, no, we're not trying to get you to memorize the whole doggone page. I'm just telling you that what's the purpose of it? So there every decade, I guess they were like, okay, now we need to focus on this. What's important for you to know is that for 2030, it changed, which means it wasn't there in 2020, to increase, it changed to discuss health equity and social determinants of health. That's something that's different, that's important to know. So there's set standards, national goals and objectives to measure evidence-based goals. And so healthy lives that are free of disease, disability, and injury. Okay. Lower or get away from health disparities. We don't want health disparity. We want everybody to have access for whatever they need. That's the perfect world. So it changed because it talked about health equity now and social determinants of health. That's completely different. There's healthy behaviors on there. And again, all of this is wonderful, but the individual has to do it themselves. You can make the most perfect program out there ever, but there has to be some action on that person's part. All right. So family has changed from what we may think is traditional. And just know that when you're going into families, it could be same sex, different race households, or it can however they define as their family. Grandmother taking care of her grandchildren, what have you. That's the family. So understand that the family structure has changed over time, and there's no right definition. What Budala may think is family and what I may think of family, or Leslie may think of family, may be completely different. But I'm not wrong. He's not wrong. No one's wrong. You know, I mentioned in class today, you know, if Dorothy and her dog Toto, if that's their family, that's their family. Who am I to not say? I've known friends of mine to get their the dogs had cancer and they got chemo. Not that that's their family, but we're not going to have animals on the test. So your family is that, and you want to involve everyone that's included in the family if that individual wants to be a part of it. So healthy versus unhealthy. Functional versus dysfunctional. How are those nursing priority individuals? So you think delegation and prioritization. So they're letting you know that you're going to come across what may be deemed as healthy versus unhealthy. May need a little bit work to be done on one family more so than the other. Some might be functional and dysfunctional, how they communicate with each other. But how do you prioritize your interventions? You have to prioritize safety first, okay? Always, always, always safety first, all right? You're doing your assessment, you're gathering information, okay? And you're working with that family unit. I don't think you guys have to worry about, I don't say, just know that think delegation and prioritization. Let me just say that. I'll give you too much, all right? So family crisis may occur. And this is when the family, again, you're not thinking of one person, you're thinking of the family, because you could have several people having a crisis in that family. But anyway, it's one unit, okay? So a crisis, one individual can cause the whole family to be unstable. So when the family is not able to cope with an event, they become disorganized, dysfunctional, and that's going to affect their health if they're not, again, you know, something's going on with mom or dad. And so that crisis is that, how is that kid getting to school? Are they having food? Who's cooking for them? Who's washing their clothes? Are they taking their medicines? I can't do this anymore. So just know you may come across that. I'm sure you may come across it in the hospital, but that's just one person. And then, you know, you get your charge nurse, you do what have you, you call the doctor. But this is crisis in the community. So know that can occur. And then let's see here. I put this picture up of an actual genome. I'm not genome, EcoMap. Let me talk about the genome. So a genome is where they can map out someone's genetic information. Let's just say someone has a strong family history of breast cancer, they're able to map out the BRCA gene, that sort of thing. Helpful information for the clients to understand their health risks. So again, you're always providing information, but again, the decision on what to do and how to do is always up to them. So your EcoMap, just get to my notes here. So your EcoMap this is actually Alice's EcoMap, all right? And so these are the people that are intimately involved in the things in her life. And then also these are different pieces of her life that can affect her her health. You see strong links. I don't think they're going to have you design anything like this, but I just wanted to show you what a legit eco map looks at. So this is like a visual representation. If you were to do this with someone, to just kind of show them how the flow of their positive and negative, because you see the stressful parts, high school, senior, repeating year. So that's her kid. But of course, if anybody with kids know what affects them affects you as a parent, it trickles down or what have you. And so those are things that are stressing her out there. And so we need to work with Mary because it's affecting Alice and everybody in that household. And so yeah, it's a good little visual piece there to provide information about relationships and what have you. So you can see why maybe Alice is not making it to her appointments. I don't know. It's a good little representation. I like it. And I put this little picture in here because this is, if this picture doesn't help you understand what a home visit is, this is actually taken from African American Archives. She's a public health nurse. I want to say back in the 40s. What I love about this particular picture, like, you don't have to show me whose mom's or what have you, but look at that mom's face. If she did not appreciate that woman, she would not be in that house, especially probably back in the era, wherever they were. And so she's giving baby a bath. She's probably demonstrating how to safely do that, water temperature, just the right amount of soap, how to care for her, how to do this, that, and the other. So that's actually a home visit. And look at, she's smiling for the cameras. That's black and white. She is showing all 32. Look how happy she is. She's so happy that lady's coming out to visit her. She don't know what to do. So I loved home visits. I love going out to someone's home and you can just get so much. You just sit down, you don't talk, you let people just do like me. And you just look, you have to have a face, like if you see something out of place, let's say trip rugs or cords at electrical outlet, you don't be like, you got to develop a face like this. But you got to take mental notes. It's the best way to get your assessment. You go out to where somebody lives. I don't care. You can try to hide what you want, but I will see things. And that's better than going to them in a hospital bed. I'm going to your house. So community nurse, how can you help overcome barriers with good communication? In my opinion, sincerity, and show that you're not non-judgmental, that you're out there sincerely to help. And it takes time because they don't know you and you don't know them. And so at first, what I do is like, and I don't want to spend too much of you guys' time, but I would go in with as little stuff on me as possible. I would have my cell phone and that sort of thing. I may have a little pad in my pocket, but I don't come in all loaded up with all my stuff and looking like I'm CPS or something like that. I just go in, try to look casual, let folks talk, interject here and there. You gotta build trust. I can tell, like that mom right there, I don't know how many visits it took for her to be able to wash her child, give her child a bath, but she cannot hide the fact that she is beaming. So again, establish and assess your environment, safety. Before you even go out there, you want to review, why are you being sent out there? What's oh, hey, little Leslie baby, hey cutie. Why are you out there? What's the purpose of your visit? Just like when you're going in to do an assessment, your community is your assessment. Just have as much information as possible so you're prepared. I know we keep saying that over and over again. So one of the things they harped on are the age-related concerns, okay? Safety for our children. SID, sudden infant death syndrome, okay? It's unfortunately it's still a public health concern. So you're educating new moms back to sleep, nothing in that crib. And you don't have to like memorize all this. They're not gonna say it. I don't think they're gonna say there's a blanket in the bed. What do you do? I don't know. I haven't seen it. But as far as infants, you wanna know that SIDS is a concern, public health concern. Remember, we're doing public health. And abuse is reportable. You're a mandated reporter. If you suspect abuse, you do your due diligence. You're legally obligated to report it, period. If you see it, you have to report it. All right, you'll get in trouble. Children, know what environmental things you should look for when assessing common areas and playgrounds. And again, safety, 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 safety. That's what it's all about. Because again, what we talked about in my class today is that, you know, preventable stuff like, are they wearing helmets and the seat belts? And then, you know, most folks think when they get out of a certain car seat, you know, there's boosters, there's different things. And adolescents, car accidents, car safety is the #1 issue for those guys as well. And then, yeah. And then just keep in mind that just because they're infants and children and adolescents, they can have like adult issues, I shouldn't say adult issues. There's children with asthma, there's children with diabetes, there's children with different elements, just like, you know, adults as well. So risk assessments. One of the things they harped on about as far as children, they really talked about gun safety. I think I'll start there. So the importance of risk assessment is that you want to evaluate for potential concerns, exposures to this, that, or the other, from cigarette smoking, environmental stuff, to guns in the home, to anything that can negatively impact someone's life. So when you're doing a risk assessment, you're evaluating for potential concerns. Just know that definition. So for young children, they mentioned they like to talk about gun safety. If there's, you know, this is not a pro or not against guns. I don't even want to go there. If you know there's a gun in the home, you talk to the parents about safety, storage, that sort of thing. And you have to be so delicate with some people and their guns, but it's not the fact that they have a gun. It's the fact that there's children in the home or vulnerable folks, and you don't just have it on the coffee table, right? You should never, stuff like that. All right. No mixing of substances with possessions and anyway. That's what you're gaining trust and what have you. Okay, so gun safety, just know that. And then school nursing. We did a whole thing earlier today about school nurses. We watched a little video. These women and men, they have my entire heart. Their population is that school. And what we mentioned earlier was back in the day, it was way back when, infectious stuff. But these nurses are dealing with chronic conditions, asthma, feeding tubes. We mentioned all that. They're coordinating with doctors and dentists. They're treating emergencies. You know, I think I have this, head lice, prevention. No, I have my notes from earlier today. Primary prevention in the schools, the primary is health education, promotion. Think of educating kids on the safety of wearing a helmet or something of that nature, or fruits and vegetables, or the food guide pyramid, or what have you. But it's nothing exists, there's no disease. So just, if you know your definitions of primary, secondary, tertiary, you can't get tripped up. So primary, anything is you're doing something to prevent something from occurring. Nothing exists, no disease is there. So if you saw that somewhere and they mentioned primary prevention, you know that has to do with health promotion and education, vaccination, prevention of injuries and illnesses, substance abuse, all of those kind of education teaching you can do to the schools, to the kids. And then, let's see, secondary screenings, head lice, screenings is a big one. What else? I don't know if they do like vision, hearing, that sort of thing. And then tertiary, again, I had a lovely video I showed where, nurses were doing feeding tubes and insulin and checking sugars and that sort of thing, breathing treatments, nebulizers, that sort of stuff. They're case managing as well, but I think case managers talked about in another chapter. I don't want to give you too much. Treat emergencies, all right? Kids that come in, I'm vomiting, my stomach hurts. Injury prevention, diminish environmental risk to kids, obesity, think nicotine, smoking, what have you. In nursing, you're going to encounter ethical issues. It's just, it's not avoidable. It's not a bad thing. You just want to know where you stand with certain things as far as, I don't know, how you feel about abortions, how you feel about this, that, the other, so that if you come across an issue that challenges you, challenges your beliefs or you this, that, and the other, you need to understand this before starting the profession, because even I have come across issues, but you still have to take care of the patient. And the country we live in, people have choices, and that is fine. It is their life. So coming in, you need to know yourself, okay? And you need to deal with these moral dilemmas. There's no side that tells you how to deal with it. What you don't want to do is not deal with it and get yourself in trouble by not providing care. Maybe that's not the job for you. I'm not going to get into all that. And so the Nurse Practice Act is on this slide, so you want to be aware of what that is. Every 50 states and territories have every state has a Nurse Practice Act. I know my Nurse Practice Act, I don't have it memorized, but as a nurse practitioner, I know what I can and cannot do. Opposed if I went back home to Florida or Georgia as a nurse practitioner. So you need to know this. Even if you're like, oh, there's so much to do. No, know what you can do as an LPN and know what you cannot do as an RN. Any LPNs here? Let me see if I can see. Any LPNs? No?
Yeah.
I can see about. Oh, Judy, okay, me too. Back in the day. Yeah, there's things you can do as an LPN that you can't do. Things you can do as an RN that you're not going to be, that you weren't able to do as an LPN. There's certain things we could push and do. And all
We
that kind
we
of stuff.
can start Ivy. know
I
we
did
can.
back in the day in
Really?
the state of Florida. We had to take
Ah.
an IV course. Now this was in 1994 or 5, but I worked as an LPN on a busy pulmonary floor, respiratory floor, and so we had to be IV certified, which means that we were not trained as an RN. You're not, but we had to take this week-long certification course at this hospital, and then we were allowed. But then there were certain things we could and could not push by law. I know that sounds complicated, but if you're IV certified as an LPN, if your state allows it, you can. If your state doesn't, then you just can't.
Oh.
It is what it is. But my state allowed. Oh, see. Okay. Ooh. Oh. Hang on. Okay. So know your ethics and know yourself. And know I've had conscientious objectives and pharmacists who don't give out Plan B, and they have another pharmacist cover. Now, I'm not going to get into was that right or not. The patient got their meds. That's all that matters. But we already knew that person was a conscientious objector, which means he got, let's say Amber was a pharmacist to prescribe that. The patient still got their meds. So that's what ethical stuff means. If you come across something that's against your religious belief, giving blood or what have you, and you're a nurse on that floor, but let's say I'm just saying, I'm not talking about Jehovah or whatever, but somebody needs to give it, whether Courtney needs to hang that bag of blood or Leslie, somebody needs to give it. That patient needs to not get their blood if the doctor orders. Y'all feel me now? That's what ethics comes into play. That means you will lose your job, potentially, because that patient needed the blood. Whether you religiously wanted to give it to them or not, that is between you and your God, but that patient needs to get the blood that was ordered. That's all I'm saying. And that concludes our presentation. Public health matters. Thank you in all of these different languages that are listed here. I will stop
Thank you so
sharing my
much.
screen. I am going to officially end it.
Can I have a question
But
for
I'm
you?
gonna stay on. I'm gonna stay on. I'm just gonna no. I'm going to
Okay.
end the
Okay.
recording.
Okay.
Okay, so that doesn't get shared what you're about to say.
Yeah.
Unless you wanted to, I guess you could.
No, it's okay. Is there any way I could have your week 1 and week 2 lectures? Because you're like the only one that I could learn from, and I've attended like 2 exam reviews already and watched my teacher's lectures.
Yes, please. Me
Oh.
too.
Still recording. This is still recording.
Oh, hey, baby. Okay, you know what? Let me write this down. What you want from me, Miss Leslie? You want my
Your week 1 and your week 2 class
Two
lectures. I'm gonna
Yeah.
be attending your class if I can on Fridays. That would be awesome because my class is on Wednesdays.
Okay, so I'm happy to if I can. I've never been asked that before. Leslie, who's your teacher?
Professor Marvel.
Oh, Professor Marvo. That's just so sweet.
Wait, I just can't vibe with her. She's a good teacher, but I can't grasp.
So
She's
let
a
me
little bit
let
too
me
advanced for me.
you see what?
Like she's too advanced, I feel like, for me.
Okay. I'm sure you're just wonderful. Email, you know what? Am I